no freaking way.
Hey, everyone. Hi, everyone. We'll get started in just a few minutes. To give some additional time for others to jump on. I'll give it 2 more minutes and we'll get started in case anyone else is signing on. Okay, I guess we'll get started. Can everyone see the slides? Good, okay. So hello, happy March. Happy second anniversary of the first COVID-19 patient being diagnosed in New York. Just kind of popped into my head this morning. So we've come a long way in 2 years for sure. So before we get going, I just want to let you know that this is being recorded and your participation in this presentation is your consent to being recorded. So if you're not agree with that, you can, I guess, leave, but I'm sure everyone is in agreement. So welcome, as I said, if you could all in the chat, just post your name, your organization. This is the way we take attendance. I appreciate that. Hello, everybody. Okay. So what we're going to do today is this meeting is the last one we will have before we meet again on April 5th, which will be an important meeting because we will look at all of the data results and primary data, and we'll look at other data sets, secondary data that we have. And we'll, as a group, determine what priorities that we will focus on from the prevention agenda for the next 3-year cycle. So that'll be quite an important meeting. So we're going to look again at our timeline, which we're chipping away at. I'm going to talk about the community health assessment survey update, talk about the key informant interviews. I'm going to talk about an initiative that we're involved with AARP here on Long Island, a little bit of state budget news, next steps, and then we'll certainly open it up for discussion. So as you can see, we are moving ever closer to our deadline of the consensus meeting on April 5th. We are in pretty good shape right at this point in time. We are in the midst of conducting the community key informant interviews. So I'm hopeful that we're going to meet our deadline with that task, although it is a little bit overwhelming, but we're working toward that. And then, of course, as you all know, the full community health needs assessment is due the end of this year, sometime probably after the priorities are selected. Oops. Hold on. Hello. I'm sorry, I'm on a phone call. Can I call you back? Bye. Sorry about that. I thought it was somebody calling in about the meeting, but it wasn't because it said Northwell. Sorry. So probably sometime in, I'm going to say end of May-ish, June, I will write a template report that hospitals and counties can certainly use in its entirety, or they can use parts of it, not use it at all. So that's my target date to do that. That's not on the timeline, so I'm going to have to add that in there. And the reason why we do that so far ahead of time is to allow hospitals that might have different fiscal years the opportunity to meet the deadline that is specific to their fiscal year. Just some hospitals have, are not on a calendar year, some are on a federal fiscal year, some are on a state year, some are on different years than that. So that's why we try to have it move so far ahead. So currently the community health assessment survey is being analyzed, well, almost as we speak, because I know the data analyst who's analyzing it is on the call. So unless she's multitasking, she's not analyzing at this minute, but she does have.
But I'm going to be sending it tomorrow, Janine.
There you go. See that? So it is done. So she's pretty much has it done. We had over 1,100 responses, which I thought was pretty good considering the year before, which was an off year for everyone. We only had, I think, maybe 500 or so responses, maybe not even 500 if I recall correctly. So this is much better, and we'll see what the data show. I'll be curious to see that when I get that tomorrow, and that, of course, will be shared with everyone on the 5th as well. The CBO survey was sent out early this year. It closed. Oh no, we sent it out the end of last year. I think we closed it on the 15th of January. We had 43 respondents, which I thought was pretty good. I didn't think we were going to get that many. But what was even more telling and more of a surprise was that 22 of those respondents said that they would like to conduct and partake in a community key informant interview with us. I thought maybe 10 the most would say they would do that. Nope, we got 22. So we've started to do those. I have to say it's very time intensive. We have a process in place where we record the interview. We are then going to use Atlas TI qualitative software analysis to analyze it. But just to give you a scope of how intense and involved this is, probably between me and my colleague here, we are, I'm going to say, a 0.35 full-time equivalent working on this. So it's just a tiny piece of what we need to do. Linda, I know you had offered to assist in doing these interviews, which you still can do. We've gotten it pretty much down to a science now, and we can share that with you. What we're saving it to the cloud, and then from the cloud, we're pulling it down and putting it into specific folders so we can go over that with you. So we do appreciate that you offered to do that. And we're hoping to have an intern as well come on board who has some experience doing this to assist us. The timeline for this, we've got a little bit of a late start. As always, right? You have the best intentions and you set deadlines for yourself, but you can't always meet those deadlines. So we got a little bit of a late start. I wanted to have all of these interviews done, I think by like March 10th was the deadline. I don't know that we're going to have them all done by March 10th. And then I wanted to leave the rest of March open for us to do all the data analysis. But be that as it may, we'll do the best we can to meet that deadline. We should meet it. We'll do the best we can. If we really run into a snag, we certainly will let everyone know. 22 CBO leaders said they wanted to be interviewed. That doesn't necessarily mean that we're going to end up with the 22 once we start doing, we've reached out once, twice, 3 times already. Probably going to do 2 more reach outs and see who we get. So I kind of just went over that. We had 3 done. We have 3 scheduled for this week. We did 4 last week, so we're up to 7. So we're making decent progress. It is quite, as I said, an ambitious goal, but we will get it done. And we appreciate, Linda, your help. The AARP collaboration, just wanted to bring this up only because it illustrates what the Long Island Health Collaborative can do with each of its member institutions, the different CBOs who are involved, the academic centers, etc. We are working with them, with our hospitals, the hospitals, Nassau Suffolk Hospital Council, to provide a talk with a doc, and then follow that with 2 public walks in the summer at 2 public parks, 2 state parks. It's great exposure for the hospitals. It's following a very standardized format. It carries the weight of the AARP. They are throwing a lot of marketing and promotional efforts and information behind it, as we are. We are hosting it, and they are sponsored. They're like the sponsor, and they have great name recognition, and they also attract that 50+ age group, which are the ones that most readily suffer from all types of chronic diseases. So we're real excited about that. It's taken us probably, I'm going to say almost a year to kind of get this going and finalized. So we're happy to kick this off the ground in, I think, May 4th, and it's every other Wednesday up and through to the middle of July. And it's all virtual because they're still required to do virtual programming. And then these, the webinar series will talk about and advertise the walks, so that we hope we get a good number of people to eventually go to those 2 walks that are in August. So I just wanted to illustrate that something like this collaborative effort is something that the collaborative is able to do. We did establish a Walk with a Doc chapter back in 2016 or 17. We've held many walks with a number of organizations. And I just wanted to throw it out there again. This is always something we can do as a collaborative event with you. Even if you want to do a virtual walk, we could probably figure out how to do that as well. Or a talk series and then a walk series. We just wanted to let you know that service is available. And we have built into it an evaluation, a pre and post evaluation, so that there's data that comes out of this. Okay. And I thought, in case you weren't aware, I bring up to date a little bit on budget news that the state budget was released, the executive's budget back in January. It's a $216 billion budget. There's a good amount of money in there investing in healthcare, and it's over a 5-year period. And there's 3.1, is that 3.1 or 31 billion in aid to schools. Money for childcare, money for affordable housing option, and money for the opioid substance abuse services. It's investing in workforce, increasing Medicaid reimbursement rates, which is always very much sorely needed since reimbursement is always well below what the cost of care is. And then we are awaiting the 30-day amendments were presented last week on February 17th from the executive budget, and we are now awaiting each house, the Assembly and the Senate, to present their budgets or what they want to see in the budget in mid-March. So this time period between now and mid-March is when we as advocates, and I guess you as advocates in your own organizations and positions, are meeting with your legislators and in, promoting what it is that you want in terms of money from the budget for your own needs. Like everybody wants a piece of it. I do know the state has done quite well in terms of its revenue the past year, and there is extra money floating around, so we all want to get a piece of that. And everybody is at this point in time. This is high advocacy season. This is where we go into full gear between now and when those one-house budgets are presented. And then once they're presented, the leaders of the House, of the Assembly, of the Houses, of leader of the Assembly and the Senate will then sit down with the executive staff and work out the final details. Will come to compromise on different particular parts of the budget. And then hopefully, fingers crossed, by March 31st, they pass the budget. We have an on-time budget for April 1. I'm going to stop for a little bit in case anybody has any questions, because there wasn't really much to talk about today since we're still in the midst of analyzing and collecting data. I don't know if anybody had any questions. I can assure you we are not going to be on this call for 2 hours. That's for sure, which is good. Was anybody listening to the Public Health and Health Planning Council's meeting early this morning? That's that regulatory oversight agency that works for the state. They talked about the prevention agenda. I think it was the first item on their list this morning. Did anyone? No? Okay, well, I listened, and everything's pretty much the same. What they did emphasize, again, as we have on this side of the coin, emphasized numerous times, is the difficulty in the intermediate measure area. So we've got process measures down. We know what the end result measure is, where we want to be based on what the state has identified as the target metric on their dashboard. But what most organizations, most hospitals, CBOs, probably health departments as well, have trouble with are those intermediate measures showing the progress. Has the program that you put in place, did it achieve what you hoped it achieved, wanted it to achieve, etc. So that's still, the state recognizes that that's difficult and that it has gotten better, but it's not yet where they would like it to be. So I don't think that's news to any of us. And so the next step, so we're going to continue to conduct those key informant interviews. Once hopefully they'll accelerate in the next week or so. And then we will analyze those results, have a report ready by March 31st. In addition to the community health assessment survey analysis report will be ready at that time. And we're going to look at the Sparks data, the hospitalization data from 16, 17, and 18. And that will help us also make a decision. Anybody have anything to add? We're moving along. We're on target, which is good. Nobody has anything. Go ahead, Linda.
I was just gonna say, I'll touch base with you afterwards, by
Yeah.
email, I guess, and you can give me all the material. I have a couple of health educators who can help. I didn't know
Oh,
if you,
great.
or if you want me specifically me to do it, but,
Right, okay, I'll talk, yeah, we'll talk offline.
okay.
Let me see, let's see. And that's it, really, it's just questions, comments. I could not possibly have covered everything. It can't possibly be that no one has a question. Can it be? Yes, it can. We will be sending a summary of this meeting out, and the recording is always available, so you will have that. Of course, if you have a question after we conclude the meeting, you can certainly reach out to me. No issue there. I'm always welcome to speak to everyone. Let's see. And the next meeting, as I had said, is April 5th. I think that meeting will probably take us 2 hours, and I absolutely do hope that there's representation from every hospital or hospital system and the 2 county health departments, because we need to do this via a consensus basis. I will send out quite a few reminders about this meeting so that everyone remembers to clear their calendar so they can participate in this very important meeting. And as I said, I do anticipate certainly perhaps using the whole full 2 hours, depending upon the debate in which we engage, how intense it might be, what questions we might have, what loose ends might be left untied that we feel we need to tie up. So I would prepare for a longer meeting next time around. Any other questions? No? Well, this was good. Everyone got back some time in their day. I'm sure you're happy about that, and just want to wish everyone good health. And spring is around the corner, and next time we meet, it will be springtime, beginning of spring. And again, always reach out to me after if you have any concerns, questions, issues. Okay, thank you.
Thank you.
Thank you.